मिस्टर मेहरोज CVS एग्जामिनेशन परफॉर्म करें.
अस्सलाम वालेकुम एवरीवन. आज हम लोग CVS एग्जामिनेशन आप लोग को एक्सप्लेन करेंगे. सो लेट्स बिगिन. फर्स्ट ऑफ ऑल, ऑफ कोर्स यू हैव टू अप्रोच द पेशेंट फ्रॉम द राइट साइड एंड यू read consent, ask for the consent, and then you may proceed. So in my case, I'd be like, Assalamu alaikum, my name is Dr. Mehroz. I'd be performing the CVS examination on you. Do I have your permission or do you have your consent? And the patient would give me the consent, and then I would also ask that I have to uncover them basically. So once they've given me the permission, I'll proceed. And you first expose the patient. Since this is the CVS examination, there are four main components. There is inspection, palpation, percussion, and auscultation. So to begin, first we go with inspection. In inspection, you don't really need to palpate the patient, or you don't really need an instrument. All you need to do is look for any deformities, any defects. If this were a respiratory examination, you'd also check the respiratory rate of the patient. One more thing, the patient should be at a 45-degree bed, but we don't have that currently. We're just saying that that's what normally the condition is. So for CVS, I'd look at the patient's thoracic or the chest, basically the thorax, and I'd look for any deformities or any scarring or any markings. And what you would do is you'd approach them from where their feet are, and you'll have to look at them. You can also check the respiratory rate while you're over here. Okay? Once you're done with that, the inspection is done. Then we go to our second step, which is palpation. In palpation, you check for the four valves, or you're palpating the four valves of the heart, and you're also palpating the apex beat. For the apex beat, you'd go at the fifth intercostal space, mid-clavicular. Okay? Where we have the aortic, pulmonary, tricuspid, and the mitral. Four valves over palpate, and then we also use our hand. What is this called?
Percussion.
Really? Yeah.
Parasternal heave.
Parasternal heave. So these are the things that we do in our palpation, which is our second step. Third is percussion. For percussion, what you do is you're placing one of your hand over here, and you use two fingers, and you just tap on your middle finger like this, and you're just using your wrist movement. Okay? So we're gonna go like this, and you're gonna do this for the whole of the thorax. And what we're looking for is near the heart, the sound should be dull, and away from the heart, basically where the lungs are, the sound should be resonating. But that checks for both of them. So if the sound near the heart is not dull, that's a heart pathology. And if the sound near the lungs is not resonating, that's a lung pathology. So we've checked both of them. After we've done inspection, palpation, percussion, all three, last step is auscultation. And for auscultation, you need a step. And what you would do is all four of the valves, or all four of the heart sounds, so aortic, pulmonary, tricuspid, and mitral, you just have to listen to the sound, make sure there's no regurgitation, make sure there is no stenosis, and you're basically looking for the normal heart sounds. Once you've done with that, you're going to thank the patient, you're going to cover them as you did, as you uncovered them, and you're going to thank the patient, and that's it.